Hello, everyone. Welcome to another episode of Dr. Tashambi Speaks. I am Dr. Tashambi. I want to thank you all for tuning in. And before we get started on our topic, I want to make a few announcements. One of the announcements is I'm asking you all if you will continue to like and share and subscribe to my channel. When you do that, anyone who knows anything about YouTube, what happens is the video will be disseminated to more people. And when I think about the fact that we have over a couple million nurses in the United States, and that doesn't include the folks who are in some form of higher education in nursing or nursing students, there are a lot of people who would benefit from my video. So please like and share. Some of the people in your workplace who might benefit from my video are people that you hear complaining about their classes or concerned or afraid about some of the courses they have to take in their nursing programs if they're going on to receive their BSN completion. That's what we're focusing on right now. The NIH, National Institute of Health, they do want 80% of all nurses to have their baccalaureate degree. We did not hit the mark by 2020. We know COVID came in, but that goal has not gone away. And so the hospitals, healthcare organizations, they are still pushing and requiring nurses to receive their baccalaureate degree. So that's one of the reasons why I'm taking time to make these videos, just so you all can have some support as you approach that in your quest to acquire that degree. I also want to talk to you all about your license renewals for the people who are on the even years, such as myself. We are still required to have 25 contact hours. We need contact hours in pain, and we do have to have that one-time identifying victims of human trafficking contact hour. As I've said in times past, please make sure you put your contact hours in a place where you can readily put your hands on them if you are abstracted by the State Board of Nursing after the window closes this year for us to be able to renew our license. If they abstract you, you just simply need to send copies of your proof of your contact hours, and then make sure you keep those records on file as well. Now, my third announcement, I want to talk about Nursing Detroit. Nursing Detroit. I used to say Nursing Detroit is a Facebook page, and now what I say is Nursing Detroit is a community. A community is a group of people living in the same place. And I say we live in the same place, we are nurses, and we all understand what it's like to work in healthcare, despite all the different areas that nurses work in. Your pediatric nurses, your nurses who work in OB, psych, community, education, such as myself, your ICU nurses, your med-surg nurses, your outpatient, your ambulatory care, the list goes on and on and on. So I just want you all to know that Nursing Detroit is an absolutely amazing place. It is located on Facebook, and you just have to request to be entered into the group. It's a safe group. It's a place where you will laugh, you will cry. We are on all types of journeys with each other. As nurses, we know how to pull our sleeves up, and we know how to get down in situations with people. So it's a place where you are safe. It's a place where you can ask questions. There are experts in the group who can answer questions that you might have about employment, prospective places to go for employment. We are permitted to put some of our lived experiences in terms of nursing inside of the group as well. And it kind of gives you insight. So make sure, and if you are already a member of Nursing Detroit, why don't you go ahead and recommend it to some of the people that you work with? I know I am always asking people, are you a member of Nursing Detroit, when I'm at the different hospitals with my students? So please remember, Nursing Detroit is a community, and it is a safe community for nurses, a place, like I said, where you can get a lot of knowledge, information. There are mastermind classes that you can take inside of the group when you are prepared, ready, or thinking about taking your nursing to another level. So let's get into what we're going to talk about today. So today I want to talk about the dreaded research class. yes. Oh, yes. If you are in your BSN completion program, I'm sure you have looked at your list of courses to take and you see that research class is coming up. And so, what I want to do, and some of you might be in it already, so let me throw out a lifeline to you. So, one of the things that you have to think about, in order for me to make things make sense, I ask myself, why do I need this? And once I can put that into context, it doesn't seem as painful. So, the research class in nursing is so important because nursing is an art and a science. And I know you all have heard us say that over and over and over again. Nursing is art and a science. Nursing is an art and a science. The art is the fact that we take the science and we implement it into our clinical environment. The art is associated with the fact that every single solitary human is unique. And what that means is when we take care of a patient, we are taking care of every aspect of that patient. And I'll tell you why. The reason why is because the patients come into the hospital with their lived experiences. They come into the hospital with their values, their beliefs, their mores, their customs. And we are responsible for taking care of these patients or our patients from a holistic perspective, meaning that we take their age into account, we take their religion into account, we take their past medical history into account, we take their current medical history into account. So when you think about that, that's the art of it. But the science, it extends beyond the medical diagnosis. The science is how are we going to best implement the care that our patients need to receive in a way that is rooted in research and proven to work. And that is the science of nursing. Okay. So, with that being said, we must know something about research as nurses. We have to know about research. And even if you are not a researcher, it makes it easier for nurse leaders, managers, chief nursing officers when you are leading nurses who have some idea associated with the science of nursing. That science that's associated with why we do things the way we do things. We hear words like evidence-based practice, but what does that mean? It means that there have been a lot of research done on this particular practice, and we have did a literature review, and we've discovered which way will get us the best outcome. That's one of the reasons why we wash our hands, because we learn from washing our hands, putting that soap on our hands, vigorously rubbing our hands together. We bust up the protein that was surrounding the bacteria. As a result, the bacteria was gotten rid of, and now we reduce or decrease the risk of our patients becoming infected because our hands are dirty. It's just that simple. So it's even simple when it comes to pain. I was telling one of my students not long ago, when people aren't able to talk and describe to us their pain or rate their pain on a scale of 1 to 10, wouldn't it be unethical of us if we did not have a way to measure pain on people who were comatose or on people who weren't able to communicate to us verbally? It would be so unethical. So we've had research studies done that have allowed us to be able to implement measurement tools for pain among people who are not capable of rating their pain on a scale of 1 to 10. So this is the ethics of nursing. So let's talk about the actual research course. When you are signed up for a research course, you have to know that there are certain learning outcomes that every baccalaureate nursing student must know. So for this talk, what I did is I just pulled down a syllabus from a university, and it's not even in our state. We're in Michigan, for those of you who may be listening from out of state. And I just pulled down this syllabi, and it is a research course syllabi, and it talks about the student learning outcomes. So the outcomes we know are things that we all need to know once we leave a course. When you think about a research course, there are certain things that we all have to know. And what I did for this particular course, there are 9 things that the students should learn about research when they are done with this course. I'm not going to go through all 9 of them, but what I do want you all to know is if you would take the objectives that is on the course syllabi that you all have, copy and paste those objectives into a search bar. You will come up with a lot of different articles associated with those objectives. So let me give you an example. On this particular syllabi, it says describe common research methods used in nursing. All you have, so you know, in order for you to successfully complete the class, what do you think the course facilitator is going to require you to do? You're either going to have to do a research paper on different research methods, or you might have to do a PowerPoint presentation on different research methods. They just need proof. We just need proof that once you are done with the course, we have deliverables. Another word for deliverables is assignments. We have had you all do assignments that indicate that you understand this particular objective or this particular concept. There's another one. It says explain legal and ethical issues in nursing. So you know they're going to have you do a paper that talks about how you need to protect people who are participating in a research study. You want to make sure that people are informed. It's just like when we go and have surgery. Don't we have to do informed consent? So I would think if I were a course facilitator and I wanted to make sure you all had a good working knowledge about ways to examine legal and ethical issues in nursing research, that would be something that I would definitely have you all talk about. I want to make sure that my students understand how to make sure that you are ethically practicing properly when you are conducting research. Children are considered vulnerable populations of people in research. Prisoners are considered vulnerable populations when we're conducting research, and elderly people. So at minimum, you should leave the course knowing those 3 things. Do you understand, beloved? So what I also want you all to think about is another objective says discuss the differences between research and a research question. Another one is you want to be able to make sure your student leaves the class knowing the difference between quantitative and qualitative research. Notice how I enunciated the L, because you know what I started telling my students? When you hear quantitative, Q-U-A-N, when you hear that quantitative, that N, think about numbers. Quantitative research is research where we abstract feedback from the participants through surveys, and the survey responses have numbers attached to them. So let me give you an example. That's your Likert scale. How likely are you to recommend our services on a scale of 1 to 4? Once you start seeing numbers, you are dealing with quantitative research. Think about numbers. Now, the other major form of research is qualitative. Language, language. Think about language. Think about words. Those are studies where the researcher wants to know how you feel. Or we might say things like, what is your perception? Your perception is your individual feeling, patient's perceptions about pain. When you start seeing things like that, this is when you are going to get into rich data where people are describing how they felt or how they feel in the midst of some life occurrence that's occurring to them. It could be a mom who recently had a baby. How did you feel regarding the care that you received from the nurses after you gave birth to your twins? Right? And they might look at how does this mom feel when she gave birth to triplets. It's information that we need as nurses. And what we do is we compile that information, then we analyze the information, and we disseminate the information in what? In research articles. And those are the articles that we go out and we abstract those articles and we do rich literature reviews, because we all know our research is not created the same, it's not conducted the same. So we're talking about peer reviewed articles where a board of experts has looked at this research from many different angles. They've asked all types of questions, all the what ifs, and now we can trust that this is a good scholarly article from a scholarly journal. We're not just talking about picking something off the internet. We are talking about something that has been tried and something that has been tested and something that we can trust, that can be implemented into the clinical environment. So I hope that I have highlighted, I would say, some things associated with research and kind of taking a little bit of the scare out of it. I think a lot of times in nursing, things are difficult for us because we don't always understand the verbiage. But once we understand the verbiage and we understand, why do I need to take this course? What am I expected to learn from this course? The answer to that question is inside of the learning objectives. And like I said, every learning objective in a course is going to be connected to an assignment. It's going to be connected to an assignment. And sometimes this is why your reading in your books is so important. And sometimes I'll tell you this, what I used to do, if I didn't understand what I was reading in a book about a particular topic, I literally would go on YouTube, and there would always be a professor somewhere who would have made a video related to that particular topic. So just know that is something else that you can have in your toolbox in order to help you make it through your BSN completion program. I remember when I was in my doctoral program, I found a professor. She was down at a university in Florida, and if it were not for that lady, I don't know what I would have done, because she literally broke down how to conduct a literature review for your doctoral dissertation. And I think my doctoral dissertation in my chapter 2, I ended up having to review 85, I believe it was 85 research articles. So I just want to let you know the magnitude of the work that is required when we take on a work such as that. But I also want you all to know, guess what? You can do it because I did it. And if I did it, I'm telling you, anybody could do it if you have a desire. That's the hardest part, is accepting the fact that the course in and of itself most times is a rigorous course, and all you have to do, and I'm not saying all in terms of minimizing it because it can be painful. I'll confess, I did shed a few tears, y'all, but I made it. And so I want you to know you can make it as well. So all you have, a lot of times, is a matter of defining the words and looking up the words in the course objectives just to make it make sense to yourself. So I hope that I have helped you all. I do want you all to continue to follow me on my Instagram channel at Dr. Tashambi Speaks. I'm in Nursing Detroit. I am there. You can also email questions to me that you may have. It doesn't have to be related to a BSN completion program. It could be related to anything associated with nursing. I do read your questions. I will make videos because my goal is for you all to succeed. I want you all to succeed, and I want you to feel good about what you're doing. And guess what? I want you to live your best life. So follow me on Instagram. Follow me on Facebook at Tashambi Allen. And then also send your questions to drtashambispeaks@gmail.com. You all have a great day and stay safe out there.